Dr. Bruce Greyson was raised to believe that what you see is what you get. His father was a chemist who taught him that only the physical world is real, and that if something can't be measured in a lab, it probably doesn't exist. By the 1970s, Greyson had entered his psychiatric residency with that same worldview. He assumed the mind was strictly a product of brain biology, and that any patient reporting an out-of-body experience was simply suffering from a symptom of mental illness. That baseline was tested by a college student named Holly. She had been brought to the emergency room after an overdose, and when Greyson arrived to evaluate her, she was comatose and completely unresponsive. Since Holly couldn't speak, Greyson went down the hall to a separate family lounge to interview her roommate. During the conversation, he accidentally dropped some spaghetti sauce on his tie. To keep his appearance professional, he buttoned his lab coat to hide the stain before returning to the ICU. The next morning, Holly was awake but groggy. When Greyson introduced himself, she told him she remembered him from the night before, not from her room, but from the lounge. She accurately described his conversation with her roommate, and then pointed out, "You had a red stain on your tie." Holly had been unconscious in a different room while the stain was hidden under Greyson's coat. If the physical brain is the only source of perception, a comatose patient should not be able to gather precise visual data from 50 feet away. 6 months into his training, Greyson encountered another patient who challenged his expectations. Henry had survived a suicide attempt that left him with severe facial injuries, a result of deep depression following his mother's death. Henry described a hyper-real experience during the trauma. He found himself in a lush meadow of wildflowers, where his deceased parents were waiting to welcome him. While Greyson initially viewed this as a hallucination, the outcome was unusual. Instead of remaining despondent, Henry's suicidal ideation vanished instantly. He was calm, composed, and no longer felt the need to end his life. Standard neurophysiology categorizes these visions as psychological defense mechanisms. However, Greyson noted the discrepancy. A typical hallucination does not usually provide an immediate, permanent resolution for chronic clinical depression. In 1975, Greyson began working with Dr. Raymond Moody at the University of Virginia. Moody had just published a book on these experiences, and he presented Greyson with boxes of letters from patients who had lived through identical events. Greyson realized these weren't isolated incidents, but the medical field lacked a way to study them. There were no standard criteria for what constituted a near-death experience, and definitions varied from one doctor to the next. To Greyson, dismissing these widespread reports as impossible felt like a rejection of scientific inquiry. If these events were happening to thousands of patients, they required a systematic investigation. But he knew that anecdotes aren't data. To bring this subject into mainstream medicine, he needed to find a way to translate these subjective, ethereal stories into a quantifiable mathematical framework. This chart on the cover of Greyson's book represents the intersection of medicine and the unknown. In 1983, he published the Greyson NDE Scale, the first clinical tool designed to translate subjective accounts into standardized data. The scale is divided into 4 components. First is cognitive, measuring time distortion, thought speed, and universal understanding. Second is affective, tracking peace, joy, and cosmic harmony. Third is paranormal, gauging sensory vividness and out-of-body sensations. Transcendental documents encounters with unearthly worlds or deceased relatives. Each item is scored from 0 to 2. Greyson established that a total score of 7 or higher serves as the clinical threshold for a genuine near-death experience. This scale provided a gold standard for the medical community. It allowed researchers to reliably separate NDEs from organic brain syndromes, drug reactions, or nonspecific stress responses. The most challenging cases for the materialist model are veridical NDEs. These are experiences where patients, while clinically dead or unconscious, report verifiable facts that they could not have perceived through their physical senses. One such case involved a patient named Al Sullivan during a quadruple bypass surgery. His eyes were taped shut, and his heart was stopped while the surgical team worked. After resuscitation, Sullivan reported watching the procedure from above. He claimed he saw his surgeon flapping his arms like a bird, an odd detail that Sullivan shouldn't have been able to see. The detail was validated. The surgeon had an idiosyncratic habit of pointing at monitors with his elbows to avoid contaminating his sterile hands, which involved a flapping motion with his arms. The mind as brain theory struggles to account for specific visual data collected from a vantage point outside a clinically dead body. Greyson also documented peak Enderian cases. These occur when a patient has a near-death experience and encounters a person who has recently died, but whose death was not yet known to anyone in the hospital. In one case, a patient named Jack saw his nurse Anita during his NDE. She told him she had died and asked him to apologize to her parents for wrecking the red MGB. When Jack woke up and shared the message, the staff was shocked. Anita had indeed died hours earlier in a car accident involving a red MGB, a surprise birthday gift from her parents that Jack had no way of knowing about. At the time of Jack's experience, the news of the crash had not yet reached the hospital. No one present knew about the car or Anita's death. After 50 years of research, Greyson is no longer a strict materialist.
While he remains a skeptic and a rigorous scientist, he now believes the physical brain does not fully explain the complexities of human consciousness. For Greyson, investigating things that are difficult to measure is not a rejection of science. He argues that science is most effective when it refuses to ignore the facts that are the hardest to explain.
Instead of acting as a generator that creates consciousness, the brain might act as a reducing valve. Think of a cell phone. Right now, the air around you is saturated with millions of chaotic radio waves. If your phone tried to process all of them at once, you would get nothing but static. Instead, the device filters out almost everything, isolating the single frequency you actually need to hear. The filter theory proposes that the human brain does the exact same thing. It takes a vast, expanded field of consciousness and blocks most of it out. It permits only a narrow trickle of sensory data, just enough information to help you find food, seek shelter, and avoid predators in the physical world. If this is true, the dying process takes on a completely different mechanical function. As the physical brain shuts down, the biological filter begins to dissolve. The barrier drops, and that massive, unedited signal rushes in. Therefore, the ultimate test for this theory would be finding cases where severe structural damage to the brain results not in a loss of function, but in a sudden, inexplicable burst of high-level clarity. In clinical settings, medical professionals have documented a phenomenon that provides exactly this kind of stress test. It is called terminal lucidity. Consider a historical case reported in Germany involving a 26-year-old woman named Anna Katharina Emmer. She was born with severe mental disabilities and had been completely mute for her entire life. Furthermore, she had suffered from repeated extreme attacks of meningitis. These infections had visibly ravaged her nervous system, physically destroying the brain tissue normally required for intelligent reasoning and speech. Yet, half an hour before she died, surrounded by the institution's head and chief physician, she suddenly began singing dying songs. Her pronunciation was clear, melodic, and highly intelligible. If the physical tissue required to form words and process melody has been structurally destroyed for decades, complex singing should be impossible. A ruined machine cannot suddenly run perfectly unless the mind operating it exists independently of that broken hardware. Terminal lucidity occurs right before death. But what happens if the mind's filter drops? An influx of expanded consciousness floods the nervous system, and the patient survives. Dr. Greyson noticed striking similarities between survivors of near-death experiences and reports of biological awakenings from Eastern spiritual traditions. To quantify this, he developed the 19-item Physio-Kundalini Syndrome Index we see here. This tracks motor symptoms, where a patient's body might involuntarily freeze into strange positions or exhibit uncontrollable movements. Moving down the index to somatosensory symptoms, survivors report erratic changes in breathing, unexplainable shifts in body temperature, and intense spontaneous sensations moving through their limbs. Finally, the document highlights mental symptoms. Patients record being flooded by sudden, overwhelming ecstasy and a feeling of cosmic unity, or conversely, experiencing profound, unprovoked fear and confusion. These are violent, measurable biological reactions. They suggest the physical body was subjected to a sudden, massive influx of consciousness that its restricted hardware was never wired to handle. When patients recover from these crises and return to their daily routines, they are left with the memory of that unfiltered reality. Almost universally, survivors describe a sensation of what they call the inadequate shell. They report that returning to the physical brain feels incredibly restrictive, like trying to squeeze a vast, expanded awareness back into a painfully small container. Living with this expanded perspective shifts a survivor's baseline reality. The first and most consistent after effect is a complete and permanent loss of the fear of death. The second is a total loss of interest in previous motivations. Pursuits of wealth, power, and competition lose their appeal, replaced by a massive surge in altruism, compassion, and a focus on human relationships. A few minutes of oxygen deprivation or a transient drug-induced hallucination does not account for this. Chemical imbalances do not result in the instantaneous and universal transformation of an adult's core values. To find undeniable proof of this shift, we have to look at extreme human case studies. In one instance, Dr. Greyson documented the life of a man who had grown up as a schoolyard bully and eventually joined the mafia. During an altercation, he was shot and left for dead. He survived, but the near-death experience he had while unconscious compelled him to entirely abandon his life of organized crime to become a compassionate counselor for delinquent youth. Another case involved a highly trained career Marine serving as a platoon sergeant in the Vietnam War. He was shot in the chest, airlifted from the battlefield, and rushed into emergency surgery. While on the operating table, he went through a profound near-death experience. When he recovered and returned to his platoon in the field, he discovered an absolute behavioral shift. He was physically unable to fire his weapon. A deep inability to commit violence forced him to leave the infantry and retrain as a medical technician. Greyson's research suggests that consciousness is not produced by the 3 pounds of tissue inside our skulls. Stepping outside the brain's filter, even for a single moment, leaves a persistent mark on human behavior that the physical world can never fully erase.